I'm Dr. Chafin. This is a new patient for me. So, hi, Sawan. My name is Dr. Chafin. It's really nice to meet you.
Hey.
Hey. You're in for our medical safe haven today for the first time. Have you heard anything about the clinic or what we do here?
Yeah, I heard some, but...
You heard some?
Yeah.
Were you able to watch the video beforehand?
No.
Okay, it's okay if you haven't. I'll give you a brief spiel about it so you kind of understand what we're doing here. But the big primary thing I want you to know is that you're in control of this visit, okay? If there's something that you don't want to talk about or you're uncomfortable with the questions that I'm asking, you just say the word and I'll back off. Not a big deal, okay? So one of the unique things about the Medical Safe Haven is that it's a clinic within a larger clinic. And it's primary care, meaning that we see babies, we see moms, we see pregnant ladies, and we see very, very old people too. So we're used to just doing lots of different things at the doctor's office. There's two things that make us really special. Okay, one is that it's a residency program, meaning that there's lots of different doctors here. Okay, there's 6 of the doctors who are like me, who've gone through medical school and did extra training and graduated from that. Okay, we supervise a bunch of other doctors who've also graduated from medical school but are still doing a little bit more training. Okay, that's one thing that makes us special. The second thing is that we have specialized training in patients who've been through a lot of trauma. Okay, I want you to know that in this visit, the things that you tell me, I'm gonna believe you. Okay, I don't want you to feel like you have to explain yourself any further, or if you make a mistake and forget something or want to add other things, you're more than welcome to do that. This is as non-judgmental as it can be.
Cool.
Okay.
So you said you're a family doctor. Will I be able to bring my baby?
You totally can bring your baby. I would love for you to bring your baby.
Okay. And then will we have the same doctor or will it change?
That's a really good question, Sawan. So in our practice, because there's so many different doctors and we all have very different schedules, I want to do my best to keep you with maybe 1 to 2 doctors that you'll get used to and see. Every now and then, when you're a little bit more comfortable, we might have to have you see different doctors. But here's the thing, I'm going to give you a list of all the doctors so you recognize their faces, and I trust each and every one of them. I would be really happy for any of my family members to see them, so I would think that you're in good hands, but ultimately it's your decision.
Cool.
Okay, yeah, feeling pretty okay with that?
Sounds good.
Okay. I'm going to ask you a bunch of super nosy questions, and it's not because I'm trying to get into all your stuff, but I'm listening for things about your health that I want to be kind of thinking about, and if I need to order any labs or do any tests, I want to talk to you about those things, okay? Again, nothing that I order I'm going to force you to do. It's up to you. Okay? Can you tell me a little bit about where you grew up and how you grew up?
Yeah, I grew up in Oak Park.
Okay.
I grew up with my family.
Mm-hmm.
I have a lot of brothers and sisters.
Mm-hmm.
And that's pretty much it.
Yeah. What were the things that you liked most about growing up in Oak Park?
Playing with the fire hydrant
Okay.
when they would bust the top off,
Mm-hmm.
and mud pies.
Nice. What do you mean by mud pies? Was it with the fire hydrant?
No.
Oh.
Me and my sisters would make mud pies in the backyard with seasonings and grass, and we make little mud pies.
Oh, that's awesome. That's awesome. Yeah. Is Oak Park where you've lived most of your life?
Yeah.
Yeah. And you went through school and all of that stuff there?
Yeah, up until I was in the 7th or 8th grade.
Mm-hmm.
And then when I was 13, I was kidnapped and raped and taken to another place.
Oh, gosh. Okay. So that obviously was very, very different and drastically changed how your life looked afterwards. Yeah. Okay. Can you tell me a little bit more about that if you're comfortable?
Yeah, I mean, it's pretty much what I said. I was kidnapped after I ran away from home. From when I was walking down the street, some lady approached me, and then she introduced me to her daddy, who was, I guess, her pimp, and then I was raped, then I was taken out of state.
Okay. How long were you out of state for?
Probably a week or so.
A week or so, okay.
My mom put out missing child report or whatever, and yeah, they found me and rescued me.
Okay.
Yep.
Were there any other situations after that when you had gotten out from that week that happened?
What do you mean?
Like afterwards, when your parents got you back, were there other people who exploited or took advantage of you?
Not right then. So I was okay until I was 18, 17 and a half. And then I met this guy, and then he, was hecka cute. And he promised me all kinds of stuff, and then he ended up being my pimp.
Okay. And how long did that last for?
For like 2 years.
Okay. How long have you been in the life at this point, or how long have you been out of it?
So I just got out.
Okay.
And I'm in rehab.
Okay.
So I was in it for like from 18 until 22, 23 when I got pregnant. And then I got my son, and then I didn't get back into it.
Okay.
With a pimp.
Okay. Good for you. Awesome. And you mentioned rehab. Was that, for drug use or alcohol?
Yeah, so I was on drugs, and I OD'd on some drugs, and they took my son, and so now I'm in rehab trying to get my son back.
Okay. Who's your son with right now? Is he with family or different family?
He's with my mom.
Okay.
But he was in foster care.
Gotcha.
But then my mom got him.
It sounds like he's a big reason why you're turning everything around and you want a fresh start. Okay.
Yeah.
That's incredibly brave. Thank you for sharing all of that with me.
Yeah.
Is it okay?
You said I was safe.
You are, and I'm glad that you feel that way
You're
enough to talk about it.
You're not going to report anything I say to CPS.
Well, actually, so here's the thing on that, and I want to give you a little space here before we go any further, because I will ask a few more questions. I am a mandated reporter, and that means that if I hear some things in your story going on that I'm worried about you or someone else, that I do have to report that, okay? Nothing I've heard so far right now is something that I would report, okay?
And they already have them, so.
Well, there's that too.
Right.
And it looks like you're doing everything you can to get him back, and I think that's incredibly, you're obviously a really strong person. One thing that I do want to offer to you, if there's something in the back of your mind that you're not comfortable talking about with me because you're not sure if I'm going to report it or not, we do have someone in our office who you can talk to freely. It is a safe space. She's not going to report it to anybody. And if she feels like, oh, that's okay, Dr. Chafin can know that, then that might be something that we share together.
That's
up
okay.
to you. You're okay with that so far? Okay, that's fine. If you change your mind, you're more than welcome to change your mind. I'm not gonna look at you any differently. Okay. Can I ask, going back, you mentioned you ran away from home. What was your home life like when you were a kid?
Home life was awesome. Like I said, it was 12 kids, and so we had a really good life. My dad was a preacher, and he owned a construction company. Wow. My mom was pregnant every year. We're all stair-stepped, so we're all just like a year apart. And then he left when I was 12, and so that's when everything changed. Okay.
Is a part of that change why you wanted to run away, that one instance from home?
Well, yeah.
Okay. Yeah. That must have been really, really difficult to have happen.
Pretty fucked up.
Yeah. And then since then, when you were able to go back home after running away and after all that happened, did home life change at all? It sounds like mom then had 12 kids in her care, yeah?
Right. So my dad was gone but around, and when I went home, I didn't have any, we didn't talk about it. I was just safe at home, but I was still,
processing it.
Right.
Yeah.
And so I was out in the streets, hanging with, people I probably shouldn't have been hanging with. And I was selling drugs and doing all kinds of stuff.
Yeah. Do you mind if I ask what kinds of drugs you were selling and what you were using at the time?
So then, when I was a kid, I wasn't using any drugs. Okay. I was smoking weed. It's just not a drug. And, but when I got older and developed the addiction, it was meth.
Okay. And not to get too nosy into it, but was it meth that you were injecting or smoking?
So I smoked it. And then right before I went into rehab, I tried to shoot it. And it was really, 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 really bad experience.
Yeah.
Like, the guy that was doing it was like trying to find my vein, and he was like poking around, and it was horrible.
Okay.
I cried.
You were like, that's not what I signed up for. Okay.
Yeah, it was horrible. Yeah. I'll never, ever, 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 ever do that again.
Was that the only time you've ever used IV-based drugs?
Yeah.
Or you're like in the last. Okay.
Yeah.
Okay. Yeah.
It was bad.
Yeah. In all of that, would you say that was more of like an escape for you, or were you ever feel like you were forced to do the drugs?
I started to use it after I got pregnant with my son
Okay.
because a friend of mine told me that it'll help me lose weight,
Mm-hmm.
and then I got addicted to it.
Okay.
So I don't know if I used it to escape. I used it because I wanted to use it,
Right. Okay.
and then it maybe helped with escaping
Yeah, sure.
after the addiction started.
Okay. And then other than the marijuana as a kid and then the meth use, anything else like cocaine or heroin or?
A little bit of cocaine here, a little
Okay.
ecstasy here,
Okay.
a little of, that's pretty much it.
Okay. And
Probably
no
tried-
judgment. I'm just asking to make sure I have a full picture of what's going on or what happened in the past.
Oh, okay.
Okay.
Yeah.
Yeah. Sometimes I ask those questions even of like older ladies because I think, oh, why would they ever say that? And then I'll find out, oh, they're using ecstasy on the weekends. I'm like, okay, well, now I know.
Yeah.
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 Any alcohol use with all of that?
Oh, yeah, of course. Alcohol.
Okay. Is that something currently that's still going on or how
Oh, I'm
frequently?
in rehab now.
Oh, that's right.
And so the people don't know this, but I'm also using on the weekends
Okay.
from the rehab.
Okay.
So I'm trying to quit.
Okay.
And so it's really hard to quit, though.
Mm-hmm.
And so I'm probably going to let them know, but,
Good.
it's hard.
Yeah.
But
You're making some huge changes in your life right now, and it sounds like you were dealt with a lot, and you're just trying to manage the best you can. Yeah. And we're here to support you in that. There's a couple of things that I'm thinking about tests I would like to order, but we'll save all that for the end, and I'll kind of explain each and every single one and why I want to do it.
yeah, and I probably need like a full physical
Mm-hmm.
because like my son is 4 now,
Mm-hmm.
and I haven't been to the doctor since I gave birth.
Yeah. Okay. Would you feel comfortable with doing a head-to-toe physical today, or do you want to wait for a little while before then?
What does a head to toe physical consist of?
So it would be like your heart and your lung exam, me checking your belly and checking your skin and making sure all your muscles are healthy, checking your nervous system, all your reflexes and how strong you are. A full head-to-toe physical would also include a pelvic exam. So I would have to, a PAP if you need it. I don't know when the last time was that you had that. Probably with your son, but we can kind of look into your records and see. And again, totally up to you. It's something that we can do today. I'm prepared for it, but if you're like, I just met you for the first time today, it's okay to wait on that too.
Yeah, well, the lady said that I can get that done, so I'm pretty much prepared.
Okay, all right. And at any time as I'm doing it, I talk you through everything, or if you're like, stop talking so much, then I'll just kind of do it. Kind of up to what you're comfortable with.
Yeah, I mean, I've had one before, so I don't need instructions.
Very
or
good.
anything like that.
With that too, for head to toe, I usually include STD or STI screenings for like HIV and syphilis.
All
that. You want it all. Okay.
all of it.
Some of it's blood, some of it's a swab. I'll kind of explain all that as we get closer to it.
Yeah, just do what you gotta do.
Okay. All right. I'm glad you feel comfortable enough to have all that done. So I think it's really important to take care of your health, and obviously you're doing that.
Yeah.
What I'm going to continue to ask you on, I know we've been talking for a lot already, but I kind of want to get a feel for your medical history and if you've had any surgeries or anything like that. So I'm going to take a brief break just to kind of get all this stuff set up for your physical, and then I'll come back and we'll kind of talk through those things too, okay?
Okay.
Is there anything that you need, glass of water, or do you want to talk to Alana while we have a little bit of a break? You're like, no, I'll just get it through it? All right, you're good?
Yeah.
Okay.
Cool.
All right. Well, thank you for talking with me. I'll be right back, okay?
All right.
Thank you so much, Sawan.
No problem.
That was awesome. Actually, Sawan, while you're here and you're mic'd up, one thing that I would like to include in this is we're talking about challenges that we faced, as physicians in the medical safe haven, but challenges also that, a patient would face. Can you maybe share just for like a couple of minutes about that initial time when you first came in? What were some of the barriers to you seeking care or feeling like you were heard or not?
Oh, so some of the barriers that our clients face, because I was not introduced to
That's right, to this.
Right. I wasn't introduced to this till I was serving clients. Sure. But a lot of the times, some of the barriers are just not feeling comfortable in the medical office at all, right? And not ever having that real life experience of having a doctor, knowing your doctor's name, being able to feel comfortable. Other barriers are like I was saying, like, are you going to tell CPS about what's going on? A lot of the times, our clients have really difficult home lives, and probably know that some things that they're doing are going to initiate that call, and so that's a barrier. Past experiences. So I've had doctor's appointments where I didn't feel comfortable, and a lot of our clients, don't feel like it's okay to talk about what they've been through. Have had a lot of stigma around, or have had comments said to them that would put them down if they do say that I'm a prostitute and these are the things that I'm doing. How many doctors would say, oh, that's okay, I'll still treat you the same? Not many, especially not before this whole HT movement. And so that's a barrier. And other things are barriers that I can't think of right now.
That's like I put you on the spot. Anything that your clients have seen from the Medical Safe Haven that have really changed their perspective on healthcare?
Oh, 100%. So 100% of our clients have had good experiences. I can't say that anyone has ever come back and was like, oh my God, Swan, that was horrible. I freaking hate that doctor's office. Like, no one has ever said that. And it has become normalized to call the doctor when something happens. Even one client that was really shy, and she had a domestic violence situation happen, and Dignity knew about it before us. I was kind of like, what? But I was really happy because she knew where to go, and she went somewhere, and she felt safe to come here. And so they've all had really good experiences, and they bring their families here. You know what I mean? It's really, 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 really beneficial.
Awesome. Well,
Yeah.
Thank you, Sawan. So I actually haven't heard your story before, so that was like cold for me, being like, I don't know what Sawan's story is. Let's figure it out.
Oh, that was just a little tidbit,
I
drop
know.
a little bit in the bucket for you.
Yeah. No, but thank you for sharing that with us. That was.
Yeah, and I just want to say, just as, because this recording is just to have hope for your patients, right? Because that was me 7 years ago, and now I'm a completely different person using that experience to help others. And so there would be clients and patients that come to you, and you're like, golly, this girl's been through a lot. But she can be a homeowner. She can be a very successful professional. She can be a great mother. Like, she has a future. And so just always believe that there are futures and there is hope in everyone, even if they are just unbearable. Because they are sometimes. I was unbearable. And so that's it.
Thanks so much.
You're welcome.